Well, March is National Women's History Month, and we're doing a feature at Dave FM saluting and honoring women who made a difference and are really helping the community. And Dr. Meacham here at Children's Healthcare of Atlanta has been kind enough to talk to us. Okay, you've come to show, you went through medical school. Talk to us what you do on a day-to-day basis. Run through a typical day in Dr. Meacham's life here at the hospital.
Well, it varies. So Monday might be real different from Tuesday. But my typical clinical day is we'll start at about 7:30 in the morning with our case conference, where we sit and talk about the children that are going to come to the Cancer Survivor Program that day. And we'll go over any special needs they have. When patients come to the Survivor Program, it's an all-day visit. We sit down and review with them their whole history and anything that late effects they might be at risk for. And then we schedule all of their tests. So we start seeing patients about 8:30, and we probably finish up about 5.
So your job is not so much, as we talked earlier, you're not an oncologist. You don't treat or diagnose cancer. You help patients after they've gone through their treatment, and that's why they call it the program that it's named. What are some things that you do specifically after patients have been treated? What do you try to do? What is your goal with the patients?
That's a great question. Our goal in the Cancer Survivor Program is to help these kids be as healthy as possible. And one of the ways to do that is to screen for any late effects or side effects that they will have from their cancer treatment, like short stature or learning problems or hearing problems, and find them early and get them addressed. My goal is that if you line up a cancer survivor with 10 of his peers, you can't tell which kid in that group is the survivor. So we're all about maintaining health and quality of life.
Are we winning?
We're winning. We're definitely winning, but I think my message is we're not done at cure. We still have a lot of medicine to deliver, even once the child's been cured for cancer. Almost 60% of children will have some kind of late effect. Some might be minor, some are more severe, but we want to pick those up and get them treated.
Cancer is a very personal disease, as you well know. How do you not take it home with you? How do you not make it a part of your life all the time, or do you?
There are some kids that are going to stay with me all day, all night, all week, all year, and I think about them. But I think, again, I'm really very fortunate in that I see those that have fought the battle and won, the survivors. And so I think that knowing that, it really helps to be able to do the best we can to be sure that they're strong and they're healthy.
What are your challenges right now, your biggest ones? Is it administrative, financial, a little bit of both? Or is it something that someone maybe wouldn't expect?
Well, we do a good bit of clinical care, and we do research too to better understand what kind of late effects children will have. So, we have the whole research dimension of, how do you get funding? How do you execute the research project? But I think, and then, there are administrative things, but everybody has administrative things. I think my biggest challenge is we know who we have, but there are a lot of kids in Georgia who have survived childhood cancer who haven't made it to a survivor program. And we want every kid to be evaluated in a survivor program. So we're actually partnered with the other 4 pediatric hematology oncology centers in Georgia to make our state an example of how to cover a whole population in regards to survivorship follow-up.
Wonderful. Dr. Lillian Meacham, thank you very much.
Thank you.